Dr. Chris, orthopedic surgeon and sports medicine physician, and today I'm reacting to Grand Slam tennis injuries. No, not all of these videos are going to be from Grand Slam tennis, but it just kind of rolled off the tongue better, so that's why I said it. Some of them are going to be from some other stuff. I don't know, Wimbledon, I'm not sure. Today we're going to cover tennis injuries.
Yeah, I got it.
Let's get right to the videos. So the first one, I can see grass court. Grass court tennis is always a bad combination. A serving player here on the near side of the screen, she serves the ball, it gets returned to her, she goes to return this volley or return the ball, her left foot slides out and her right knee falls into a valgus position. So in other words, that means that her knee is towards the inside aspect, it's inside of her planted foot, and the inside of her knee opens up. There are a number of structures that live on the inside part of the knee here. We know that she suffered at the very least an MCL injury, if not also medial meniscus and or an anterior cruciate ligament injury. If it was MCL alone, it would take approximately 6 weeks to heal, after which time she could rehabilitate and then get back to her regular activities. And it's not typically something that she's going to require a knee surgery to repair. If she has neutral alignment, meaning that her knees are directly over her feet and directly under her hips, or each leg is a straight line, or if she has varus alignment, which means that the knees are slightly outside of the line between your hip and your ankle, then she will not require operative fixation of the MCL. However, if she has valgus alignment, meaning that the knees are inside the line from your hip to your ankles, then she may require operative fixation of this in the future. But at either rate, she should be able to get back to tennis just fine after proper rehabilitation and after she is healed. Let's see what we got here. This is an artificial surface. This player, as she is running to attack the ball, she plants her left leg on the ground as part of her follow through. And you can see here that as she attempts to decelerate, her knee falls into valgus when she plants that left foot, and immediately she falls to the ground, grabbing her left knee. And this position of dynamic valgus is an ACL killing position. This is the position in which ACL ligaments are most frequently torn. It's hard for us to know whether she's only stretched or sprained the ACL ligament, or whether she has completely torn it. But certainly, we know that the ACL has seen some load here and is most likely to have suffered some degree of injury. If she's really unfortunate, she may have suffered what we call the terrible triad, which is a combination of an ACL tear, an MCL tear, and a medial meniscus tear. And this combination of injuries is associated with a poorer outcome after injury and after rehabilitation than just an ACL tear or just an isolated MCL tear or an isolated meniscus tear. But certainly, if she has suffered a full ACL tear, then more than likely this is something that will require surgery for fixation in order for her to return to the same level of play. And current studies are now suggesting that anywhere between 1 to 2 years of rehabilitation is required after an ACL ligament reconstruction before you can get back to activities that you engaged in at the same level that you were able to prior to your injury. If you want more information on what to do after an ACL reconstruction, be sure to check out my video on how not to tear your ACL. Link will be down in the description. For this next example, we have a player who is running towards his left-hand side on a grass surface. And as he reaches for the ball, his left foot slides on the grass playing surface, allowing his knee, which was previously in a slight amount of flexion, to fall into extension and then subsequently hyperextension, causing him to suffer a hyperextension injury of the left knee. And we know that this player was already having some problems with his knee because we can see that his left knee was heavily bandaged and taped already. If he's lucky, this player may have simply suffered a ligamentous sprain of the knee, where no structures of the knee have actually been torn. However, some of the structures that could be injured with this type of mechanism would include the PCL or posterior cruciate ligament, the posterolateral corner of the knee, the posteromedial corner of the knee, the popliteus, or even the hamstring tendons of the knee. Also injured the menisci of the knee, either medial or lateral, and he may have also suffered an avulsion injury of the tibial tubercle. That's the point of the joint where both the ACL and the PCL attach, and furthermore, he may have also suffered a tibial plateau fracture of a minor nature. The potential for significant injury after a mechanism such as this is quite high. And hopefully this player hasn't suffered a career-ending injury which will affect his ability to play this sport in the future. Okay, so let's go to the next one here. So let's see, we have a guy running for the ball to the left-hand side. Oh! And so you can see here that as this player goes to reach for a low shot, his shoes grip the playing surface quite well, but he doesn't have the strength in his ankle to avoid rolling over onto his ankle. So as he plants his foot falls into inversion, meaning that the sole of the foot gets turned up towards the inside or the midline of the body, and he rolls over onto that ankle. He basically turns that ankle at a 90-degree angle from what it is normally supposed to be. As the foot inverts on the end of the tibia, the structures that can become injured are the end of the tibia, or the medial malleolus, as the talus comes up and bangs into it, and if the inversion proceeds far enough, then the distal fibula can be avulsed off by the attached ligaments, if of course the ligaments don't rupture. Now, if this player is lucky and he's managed to get away with simply an ankle sprain, then this is something that will require several weeks of rest and physiotherapy in order to restore him to playing condition. However, if he's been unfortunate enough to have suffered a fracture, this more than likely will be an injury that will require open reduction and internal fixation of the ankle on either one or both sides. He will be immobilized in a cast for an extended period of time and then eventually allowed to rehabilitate that ankle. It will probably be several months before he is able to return to training, and probably then again several months, after which time he can return to competitive play. Okay, so this one, artificial playing surface, running to her left-hand side, about to do a two-hand volley, and we have the grippy playing surface, ankle inversion monster, coming up to bite her. So I'm beginning to see a theme here, and there are a lot of inversion ankle injuries in tennis.
Continuato, clamoroso, eccolo qui, mamma mia.
So she landed okay. Gone on with her.
She went down hard and rolled over that right ankle.
Where tennis players themselves so often.
It's probably a good idea if you are a tennis player to make sure that you spend time developing the strength of your lower extremity so that you can have good dynamic stability of the ankle when you're playing the game. Because if you don't, you just might get hurt. So, I hope that you've learned something today about the sport of tennis and the injuries that can occur. So be sure to check out our sister channel, Human 2.0, where we show you lots of great strength and mobility exercises for all parts of the body. And as always, that's been a word from Dr. Chris, not your everyday ortho. No.
Okay.